Hello, my name is Sunita. I'm a respiratory physio. Welcome to your education session on self management. Today, the aim is for you to understand your normal symptoms with your lung condition and what you can do to reduce or control your symptom, and finally, how to recognize when you have a chest infection and what you can do about it. So, let's talk about what are the common respiratory symptoms. These are your common respiratory symptoms, which are short of breath, cough, sputum or mucus, and then wheeze. You might have all of these symptoms, or you might have one or two of these symptoms. Short of breath can be when you're at rest or when you're on exertion, and then you might have a amount of mucus, which is normal for you, and a particular color, and you might have some wheeze, and then you might have some cough, which is absolutely normal for you, which might be a morning cough or it can be throughout the day or even in the night. Let's talk about triggers now. Triggers are things which make your symptoms worse. So, for example, cold air, stress, or sometimes pollution, and also sometimes infection. So, these are triggers make your symptoms even worse. For example, cold air, when you go in the cold air, you tend to cough a lot. So what we advise is to have a scarf around your mouth to keep your mouth warm. So when you go out, you tend to not cough much. Also, for infection, we advise people to have keep their vaccination up to date, like flu and pneumococcal vaccine, and also avoid sick people, so you have less possibility of developing infection, and also to avoid polluted area. Stress is another factor which can make your symptoms worse, like short of breath. So, trying to find ways to reduce stress can also help you in reducing your or controlling your symptom. The next is self-management plan. It's very important to keep a record of your condition, for example, your symptom, your medication, and when you recognize a change in your symptom and what you did to control or manage that symptom or chest infection. So, recognizing a symptom of exacerbation, which could be infective or non infective, and recognizing your triggers and control or reducing your symptom and reviewing your progress. So, it's very important to have a record of all these things so you can have a better management in the future. British Lung Foundation have produced a brilliant book which is called the Self-Management, COPD Self-Management book, which have a flare-up management plan and a flare-up tracker. It is very important you write down how you manage your exacerbation each time. So when you have an annual review with your GP or consultant, it's very useful to go through your exacerbation in the last year. And also it will also help you to find the trend of exacerbation and also what you have done to manage that and what worked and what didn't work. Recognizing symptom is very important. As we had discussed earlier, there are common symptoms with lung condition. So you need to identify what is normal for you. So you might have a degree of cough, a degree of phlegm and a phlegm color. Some of you might feel short of breath at rest, or some of you have short of breath on activity. So it's important for you to identify what is normal for you. And when there is a change in the symptom, or when the symptoms get worse, you might need to consider managing it or reducing or controlling your symptom. So you could either start your rescue pack immediately and increase the frequency of your reliever if you have been advised so. So when I say reliever, inhalers like Ventolin. We talked about exacerbation. So these are some of the signs of exacerbation, like increased breathlessness, increased amount of mucus, the mucus color change, or you have headache, loss of appetite, temperature, or swollen ankle. So if you have two or more of these symptoms, you should straight away start your rescue pack. Rescue pack consists of two things, your antibiotic and steroid. So antibiotic to treat your bacterial infection and steroid to reduce the inflammation. So if you don't have a rescue pack, that's okay. You can contact your GP for further treatment. The next slide is about respiratory condition management. So these are the things you can do to manage your condition. The first thing is stop smoking, healthy diet, keeping yourself hydrated, medication, regular exercise, and getting enough sleep. So let's talk about smoking. Smoking can cause irreversible lung damage. So continuing smoking can make your lung condition even worse. So the first and most important thing to do if you have a lung condition is to stop smoking. We can support you with that. Nicotine replacement therapy is very successful in stopping smoking in long term. But if you have tried that in the past and if you failed, it's okay because you have done the most important thing in managing your lung condition by trying the NRT therapy. Most of the people doesn't get success in their first attempt in stop smoking. So the key is to keep trying again and again, and we are here to support you. You can make your own referral to Smoke Free Hampshire, but if you need support, we can help you with the referral. Healthy diet. We all know that how important is having a healthy diet. It keeps your immune system intact by fueling up your body. But also you got to make sure you have a very balanced diet. Balanced diet is the key for your health and well-being. Next is about drinking enough. We all know hydration is very important. So the national guideline is to have 6 to 8 glasses of water. When I say glasses, it should be a big pint glass, not a small glass. So you get enough water in your system. So dehydration can put a lot of stress in your body system. So it's very important you drink plenty of water. It also helps to thinner the mucus so you can clear it easily. Medication. It's very important that you know what medication you are on, including your inhalers. So you have to write it down what medication you are and what dose you are, and also regular review with your GP or pharmacist about what medication you are and whether you need to be on that medication is important so you can avoid unnecessary intake of medications. Exercise is very important. I think we have already discussed the benefit of exercise on our first section. So exercises make your body stronger, reduce stress, gives you more energy and keep you fit and increase your exercise tolerance. So it's very important you keep on carrying on doing exercise on a regular basis. Enough sleep. Sleeping is very important. It helps our body to repair and heal. And I just recommend 6 to 9 hours of sleep. If you don't sleep enough, it will make your body vulnerable to developing infection. Avoid sick people. Even if it's your family and friends, when they are unwell, advise them to stay away. Practice good hand hygiene, keep social distancing, and avoid crowded public areas, which include pharmacies and supermarkets. So a lot of pharmacies do free service of prescription collection and delivery, and a lot of supermarkets, all of the supermarkets does home delivery as well. So try and organize for home delivery. Lions Club Medical Port. Some of you might have seen this port. It consists of a sticker and a port. The sticker goes in front of the fridge and the port goes inside the fridge. The port consists of relevant information like your medical history, your medication, and any other relevant information you want the paramedics to know. So when there is an emergency at home and when the paramedics arrive, if you are not able to speak, they'll get the relevant information from this port. So it's very useful to have one at home. Alert others. There are various alert bands which is available For example, you are diabetic, or if you are highly sensitive to high level of oxygen, or you are on steroid, there are bands available which you can wear them when you're going out. So if you have an emergency in the community and you are in a situation where you can't speak, the paramedics will identify this band and will be able to treat you effectively and more quickly. That is the end of the session. If you have any questions, please speak to your healthcare professionals, or you can go on British Lung Foundation website, which is www.blf.org.uk. Thank you for listening.